50%. Hi, this is Senthil Raghavan going to speak about the case study of fitness in the subject of predictive and advanced analysis. The organization where this case was carried out was Scripps Research Institute, California, USA. I will describe the case. Look at your wrist. I am sure most of us have Fitbits and similar health monitoring wearables on us right now. Due to the increasingly sophisticated and connected medical devices, we are now sitting on a growing mountain of fitness data gathered from people. This is both from the regulated health arena as well as in the unregulated health and wellness markets. But all of this data is meaningless unless it is used to promote some change. Both the consumers and the doctors are still trying to determine how to use this data in an actionable and an insightful way. One answer from the data science perspective is to apply predictive fitness analytics techniques, analyzing current and historical data, and then promoting a plan to increase health and wellness. Predictive analytics is an invaluable tool for measuring, benchmarking, and improving health, fitness, and wellness. It is universally agreed that predictive analysis can help increase the quality of healthcare, prevent adverse events, improve overall health, and ideally decrease the cost of treatment. Employers are also using health and wellness programs to increase employees' engagement and productivity. Latest studies are trying to explore the connection between vitals collected from wearable health and fitness devices and predict impending illnesses. If we can predict impending illnesses, then we can take corrective measures or provide suitable treatment at the right time. The data description and pre-processing. The data that we obtained from wearable devices is a huge collection of several variables. Depending on the illness we are trying to predict, we have to reduce the number of variables and restrict the data by using the factors that contribute to the impending illness in question. For example, we are trying to predict if the person might have a stroke or an MI. Then we restrict our data to heart rate, blood pressure, and oxygen concentration, the speed at which they walk, or the speed at which they cover does not have a direct bearing in the short term prediction of these two illnesses. The next important pre processing step with the fitness data is data filtering and data outlier processing. Data filtering and data outlier processing are to avoid the extremes of data corrupting our data set and thereby producing variations in the expected results. The last step is the data normalization. The normalization in many learning algorithms is to assume that all features are zero mean and have variances in the same order. If the variance of the feature is several orders of magnitude larger than the variance of other features, it will dominate the learning algorithm, increase the system weight of certain features, and also skew the results. Hence, data normalization is done before we apply and machine learning test or training. The algorithms used and reasoning are basically the algorithm chosen is usually the SVM algorithm, that is the support vector mission algorithm. It is chosen because it has superior performance with such data and a solid theoretical foundation. The biggest difference between the support vector machine and other learning methods is that the SVM is based on the minimization of structural risk rather than minimizing the empirical risk in traditional algorithms. So, in the SVM based training and prediction process of classification model, the effect only depends on a few support vectors. Hence, It has high processing power for high dimensional samples. As usual, a proportion of the data is for testing and a proportion of the data is for training. Usually, a train test ratio is about 20% and 80%. So, the conclusion, with the abundance of fitness data available from the wearables, it is very essential we put into good use and try and predict illness which can be prevented and treated early. Several studies are going on to see if wearable data can provide early indication of viral illnesses of influenza and of even COVID in recent times.